AB was nice talking. I saw this article and I thought it was interesting, and so we're going to talk about it. This one, Daily Mail. Washington tables bill to ban vaccine exemptions for philosophical or personal reasons as measles spread becomes a quote-unquote state of emergency. Measles cases have surpassed 56 in Washington state. Statistics show state representatives calling to end personal and philosophical exemptions. Washington is one of 18 states that allow exemptions. Oh, I love how they say, what do you call it, epidemic levels. 56. You know, usually when there used to be an epidemic, a real epidemic, what that meant is in the thousands. Like we had 20,000, 50,000, 80,000, 100,000. You know, it was everywhere. You know, the Black Plague, you know, people, that was a real epidemic. Like there was no one you didn't know who wasn't infected or knew someone who was. That's 56 in an entire state. That's like 2 school classrooms. Actually, less than 2. Let's keep going. Washington State is proposing a bill to ban vaccine exemptions amid a growing measles outbreak. There are 18 states, including Washington, that allow families to skip the protective shot for philosophical and personal reasons. But health officials say the spread, with 56 cases confirming in the Pacific Northwest, have reached epidemic levels that warrant declaring a state of emergency. Monica Stonier, state representative of Clark County, which has 51 cases and 13 more suspected cases alone, is sponsoring a bipartisan bill that she hopes will cut rates. I want to know who funds her. I bet she's got. I would put money that she is taking money from a pharmaceutical company. Who is it? Pfizer, GlaxoSmithKline, AstraZeneca? I bet you she does. Because that's what you have to look at. Who, not them, who's the money behind them, and then you'll know why they're doing what they're doing. The puppet masters, if so to speak. The bill would have every child at every public and private school in the state and licensed daycare center receive the mumps, measles, and rubella vaccine unless they have a legitimate medical or religious reason not to. I'm glad they mentioned that. I mean, I remember seeing a photo of the, the warning paper that comes in those shots. It was like the size of a movie poster. There was so many things written on that. It wasn't just like, you know, when you have a pack of paracetamol, it's just a little thing which says, you know, don't do this and don't do that. You know, it's about the size of your hand. It was huge. If you'd be stupid to take one of these shots. That's what I think. I'm not a medical doctor, but just any of the research I've done tells me that these things are not safe. Right now, my city is the hotbed for the outbreak, Estonia told CBS. Outbreak. Oh my god, we're in The Walking Dead. They're everywhere. It certainly has reached a critical state in my county. Critical state. What the hell does that even mean? Estonia said 78% of under 18-year-olds are vaccinated in Clark County, which neighbors Portland, Oregon, at least 10% lower than the ideal. Anti-vaccination movements have grown across the country in the last decade, prompting panic from the medical community and fire hitbacks on parents who say they do not trust the medicine. People affected with the virus have visited several locations in the Portland, Vancouver area, including elementary and high school parks, churches, urgent care facilities, and the Costco and IKEA. Measles is a highly contagious infection caused by the measles virus. When someone with measles coughs, sneezes, or talks, infected droplets are sprayed into the air where other people can inhale them and are then infected. Symptoms present themselves between 10 to 14 days after infection, include fever, cough, runny nose, and a total body skin rash. Once common, the measles disease is now rare due to the MMR, measles, mumps, rubella vaccine. Okay. Is it not possible that access to better health care and screening and hygiene has gone rid of it? Is that anything to do with it? Okay. The Center for Disease Control and Prevention recommends children receiving the first dose at 12 to 15 months old and the second dose at 4 to 6 years old. The vaccine is about 97% effective, but those who are unvaccinated have a 90% chance of catching measles if they breathe the virus in. Before the measles vaccine was available, more than 500,000 cases were diagnosed in the U.S. every year, about 500 deaths. And, you know, it's funny. When people talk about vaccines, they say the danger of them is 1%. And, you know, and I remember a statistic coming up that 4 million children are vaccinated in the U.S. And I thought, well, 1% of that is like, what, 40,000? Now, if you just take what they said, 500,000 cases every year with 500 deaths, so that's what, 0.1%. That's less than people who are vaccinated. That's less than a deaths percentage that they give for vaccinations. And 500 annual deaths, I mean, all of them are tragedy, but to introduce this kind of untested medicine is quite dangerous in itself. And don't take my word on any of this. Do your own research on these vaccines. Believe me, the doctors do not know anything about it. I've talked to medical students that they don't know anything about these things. They're just sort of told this is good and they just go with it. It is the second greatest number since measles was considered eliminated in the US in 2000. And just going back there. So there used to be 500,000 cases and today 56. So that's nothing. That's nothing. They're just blowing this way out of proportion. A report published by the World Health Organization last month said measles has seen a 30% increase in cases around the world. Between September 2017 and August 2018, the WHO reported more than 41,000 cases with 40 deaths in EU member states. Experts say the Portland area and southwest Washington become a hotspot of the anti-vaccine movement. State data shows that 85.7% of students received all their vaccines for the 2017-18 school year, down from 89.8% in the 2000 school year. Additionally, nearly 8% of children in Clark County were exempt from getting vaccines required for kindergarten for the 2017-18 school year, according to the Oregonian. A mere 1.2% were for medical reasons, while the rest for conscientious objector or philosophical personal beliefs. Washington is far from the only state to be battling a measles outbreak, with cases reported in California, Colorado, Connecticut, Georgia, Hawaii, Illinois, New York, New Jersey, Oregon, and Pennsylvania since January 1st. New York has seen some of the highest numbers with 64 children in Williamsburg and 30 Orthodox and 130 children and adults in Rockland County falling ill since October 2018, all in Orthodox Jewish communities. The benefits of the vaccine greatly outweigh the risks, said Dan Solomon, the former director of vaccine safety for the Department of Health and Human Services, told CBS. It can cause common problems like otitis media or ear infections, Measles is a pretty big deal for young children. I always love how crazy people get about vaccines, especially in the US. People will tell you healthcare is not a human right, but they will demand that you get a vaccination. Wait, maybe I wouldn't need the vaccination if I could just access healthcare and get treated properly for when I get sick. No, you need a vaccination. Like I said, and they won't give you healthcare, but they demand that they'll subsidize that. The government will give you that. The Walmart will have them give out those flu shots. Like I said, I'm not a medical doctor, but if you are going to consider any of these vaccinations, please do your research. Do not just blindly believe the doctors, because many of them are incentivized to give these out. And there are a couple of Instagram accounts I follow which talk about vaccinations. Now, one of them is, I think, Beth Doer, and she claims that she was a nurse. Now, I don't know her credentials for sure, but I believe she was. And there's one called Beware the Needle, and they will help inform you about this. So, and there's the internet is your friend. Keep doing research. There's loads of documentaries and sources available. Anyway, please comment, rate, share, and subscribe. I'll leave my GoFundMe in the description. I'll leave my Instagram there as well. Peace.